You're listening to Hall Monitor on WPPM 106.5 and on Philly Cam. You're watching us. And I'm back with my name's Denise Clay Murray, and my co host Larry McGlynn is joining me. And we're here with Dr. Caterina Roman, the professor from the Department of Criminal Justice at Temple University, our me and Larry's alma mater. And I'm glad that you're here to join us today, Dr. Roman, because we wanted to talk to you about the 100 shooter report that was released last week by Councilman Curtis Jones and the members of the Committee on Public Safety. Have you had a chance to look at the report? And if so, what stood out to you about it?
Yes. Well, thank you for having me talk with you. It is a pleasure. It's sad that we are talking about gun violence, but important conversation to have. So yes, I have looked at the 100 shooter report, and I think the first thing, putting this incredible uptick in gun violence aside, just having a document like this in front of us for the public to consume, for so many different types of stakeholders to examine is really, really important. I do think this marks the start of an era in Philadelphia where we can say, hey, there is data behind what's happening, and we need to pull that data together and think about what it means, even if that means the different agencies discussing that data are going to come to different conclusions. So basically, just having this report and having it be made public, which is based on data, is really important.
So I guess my question is, if data is something that we've needed to have these conversations, why have we not had it before? Has it just been a lack of willingness on the part of these various agencies to take a more take a deep dive like this?
Yes, I think the deep dive is part of it. But I think, as we all know, everyone who's reading the newspaper, we know that people say graphs and charts can lie, data can lie. So what does it mean when we all come together and we look at the same data? How do we pull it apart and take that deep dive you're talking about and go back and forth with our dialogue so we can understand what it is we're seeing? So if we see let's say in 2021, that 20% more guns have been recovered than in the year before, is that a lot? Is 20% a lot? To one stakeholder, it might be a lot more or a big increase, and to another, it might not be. So we also hear a lot of people talk about the root causes and the causes. So many of us want to understand the why things are happening, and data itself, just looking at a few points of data, might not give you the answer of why. But when you roll out a range of data related to each other, you can start looking at correlations. You can start looking at trends. Is the uptick from 2020 to 21, that's a 1-year uptick. What does that mean if we look at a larger time series? So being able to break it down and doing that with multiple stakeholders together creates this dialogue that lets you go even deeper.
Now, other municipalities have done some work with data in terms of reducing gun violence. What can Philadelphia do? I guess, has it been successful? Can Philadelphia replicate this? And how do we get past Philadelphia's natural proclivity to say, this is the way we've always done it when it comes to just about anything?
Well, again, that's a great question. And you can see from the 100 shooter report that everyone is basically looking at the same data, the same underlying data, and doing different types of analyses with it. And even, let's say, if the district attorney's office is running analyses to look at increases in the rate at which prosecutions have been dropped, and then the police department wants to do the same thing. Hey, this is everyone we're arresting, but then this large percentage of cases that are withdrawn or not processed. What does that mean? So we have a set of departments here in the city that independently, some of them use data more than others. So I want to throw that out there. Again, part of the the highlights here are bringing the agencies together to see it together, ask what questions that then brings up, and how the data is interpreted by the agencies. And I guess I can explain that a little bit better by let me use the Philadelphia Police Department as an example. They are very data-driven agency. The Philadelphia Police Department has to think about allocating their officers, and they are big believers in understanding where the hot spots are. And they think about, should we just be looking at the hot spots of gun violence? Should we just be looking at the hot spots of carjacking? If you looked at robberies altogether, for instance, it includes carjacking. How do we pick that out now that we know there's a subset of robberies that we really have to bring to the top? So PPD has been doing that, but hey, we need to take a deeper dive than that. And PPD might not have the resources to get the other pieces of data together beyond what they've been doing. So having multiple stakeholders, multiple government departments sitting together regularly, asking questions, well, do we have this piece of data? It would be interesting to know this. Well, this is not telling us what the cause of those carjackings is. Maybe we need this. Oh, Human Services has that piece of data. That is what other cities do well, that there are some cities that have a structure across city departments to be talking with each other all the time, where top leaders in the agencies say, we want to see these data all come together weekly and have meetings to discuss this, right? Not waiting until a crisis, an epidemic of gun violence has already occurred.
Now, one part that stood out to me from this report was one agency that during the press conference in which they announced this report, seemed to be, left out of the picture, because they were talking about how a lot of this goes through schools and a lot of young people, and a lot of this stuff starts, at schools and things, and yet the school district wasn't there. And how do you solve this problem if a major source of where the issue isn't present, isn't included?
Yes, so schools is a missing stakeholder here and an important stakeholder here. And I think we could look to Camden right next door. Camden has an integrated data system where the school data on truancy and dropout and other, truancy and dropout are risk factors, but there's other aspects of resiliency, youth and students who have brought their grades up, which kinds of programs have they been involved in? So Camden puts their data into a system that includes criminal justice data and health and behavioral health data. And they have groups that do come together to utilize this data to strategize about young people who may be at risk or who may be stepping for their first time into the juvenile justice system or the first time arrest. I think if you look back at the report, the 100 shooter report, you'll see that the Department of Public Health and Dr. Ruth Abaya and her colleagues there used a database called CARES, right? So CARES is a system that lets you see touch points by individuals across health, behavioral health, and other social services. And that piece of I'd say that segment in the report was really telling, because you could see, for instance, one of the pieces of data there was that of the 100 shooters, almost half of them or more than half of them had been arrested for a drug offense, right? And what if you knew that those that had been arrested for a drug offense also had a series of behavioral health? Maybe they were in a drug court when they were 15, 16. Well, maybe they're not doing well in school, right? So if schools were involved, it would add another set of important stakeholders to sit back and say, how do we serve these individuals that have multiple risk factors? We don't want to take their drug arrest and do something punitive. We want to think about how do we come together and think about social services that are supportive of pro-social behavior. And that usually happens in the schools. That's why, and I think that's underlying your question and our discussion, we want services for Philadelphia's youth and children that are pro-social, that are going to buoy them up and facilitate having these positive networks that will keep them out of the juvenile justice and criminal justice system.
Okay, I'd like to bring on my co-host, Larry McGlynn. Larry, do you have a question?
I do. Thank you, Denise. Dr. Roman, thank you for being with us. One of the things that stuck out to me in the report were during the recommendations kind of section of the report, it seemed like different departments were almost speaking different languages, or there were conflicting ideas as to how things be implemented, things like that. How do you rectify, and you've worked with law enforcement in your professional career, you understand how these things work. How do you start to rectify those differences of opinions throughout the different agencies?
So that's again a great question, and it's I think we have to look back first at the context here for the 100 shooter report. We had city council really asking for this. So I think it is incumbent upon city council and all of the stakeholders to come together and look at all the recommendations by department. And you know, there were some city stakeholder departments that were part of this report, but they didn't have a section in the report that may, you know, want to chime in. So it's these, you know, leaders, those that have the recommendation in the report, city council and others, should start picking apart each recommendation and then linking some of them together, because some recommendations, you know, one agency might say we need some more funding here, or we need to do these types of services with regard to, let's say, victim relocation, right? We need to be able to have funds. District Attorney's Office said we need to have funds for relocation. Well, who pays for that? What does that mean? How are we going to prioritize funding for all of these? So in my mind, but I should, you know, caveat this by, I have never worked in city government, but I have studied partnership collaboratives and different types of long-term collaborative interventions that have been developed to reduce gun violence and other types of problem behaviors. So I think if those stakeholders could come together, group the recommendations and pull them apart, create a priority. Which of them are the low-hanging fruit? Which ones can we do easily? Well, we simply can't easily say we're going to have $1 million more for housing relocation. Is that going to involve housing? Who divvies up that money? What is that going to mean? So start categorizing the recommendations, seeing where there's agreement, where there's disagreement, and how to best prioritize them. Some of the recommendations you could do in a heartbeat, or it may only need to be that one agency alone. I'm going to expand foot patrols. Okay, this is what we're going to do to expand foot patrols. And it may not necessarily mean a big increase in funding or large budget expenditures to do something. So that's the type of sort of frame I would put on it. How do we both pick it apart, group them together, and then prioritize?
And not to get off topic, but it sounds like what you're describing a little bit is one of the ways the city looks at the city budget. We look at, here are the top priorities, here are the things we have to take care of. And now every department has a role to play in that. And how do we do that? So the city is set up in a way to at least look at it from that lens. I was struggling with the wording of this question. So if it needs clarification, I understand. How much of violence reduction is a holistic effort? Meaning, is it every department in city government needs to be involved somehow? Is it that we're going to have the police and the DA's office take the lead and come up with policies? How do we, and looking at this report, how do we use that report in order to really implement change?
So, just caveating that the report is is looking at the last 100 shooters, or, the 100 shooters they had data on. And the city has been very focused on moving the needle quickly to make sure we are possibly stopping the gun violence that would happen tomorrow, the next day, right? And that's really important. How do we target those individuals that are currently carrying guns, that are at risk of pulling them out and shooting, or the ones that are clearly doing these robberies, these carjackings, some of them which have turned fatal? Those sort of priorities related to the criminal justice spending and what's happening upon a crime happens, those, in my mind, that does involve getting the criminal justice agencies, the law enforcement agencies together to strategize. But putting that aside, when we're talking about this sort of larger view of Philadelphia does not want to be a city that has an increase in gun violence every year. We do not want to be a city, right, that stays constantly for decades, for 30 years now. Philadelphia has been in the top 5, 10 of the largest cities in the country, always, in the top list for its homicide rate, right? It's just a horrible, horrible place to be. So to really make a dent in gun violence, we need to be thinking beyond the criminal justice agencies here, right? And so when you're looking at this report, we did have Department of Public Health. That's not a criminal justice agency. But in terms of the others, the defenders, the district attorneys, managing, director's office that has the offices of criminal justice in there, right? PPD and the others, they're all criminal justice. We have to take a step back. Denise mentioned schools, right? We have to be thinking, we have housing, we have basic social services, we have education for our young children. Do we know, what do we know about providing opportunities for young women, teen pregnancy, families that may have, single mom families that may need some support? There are so many ways to take a step back and be more inclusive, because we know, as we hear that root cause term, there are so many aspects related to our daily lives and the disinvestment that has happened in Philadelphia that create this risk for gun violence. So to unpeel the onion of these causal factors, I do believe we need top leaders of many city agencies coming together and saying, how do we understand the environment that has created risk for gun violence, right? We have higher rents. We're going to have families starting to be evicted as the eviction moratorium comes to an end. We are going to have so many risk factors here amidst this time of a budget that's already strained due to the pandemic and due to Philadelphia being one of the largest cities with the highest rate of poverty in the top level of deep poverty in the country.
So when we talk about, so this show, we focus a lot on local government and what local government can do, what it's responsible for. We believe that a big component of our show is education, so people understand how to use their local government. With that said, is this, when we look at possible government solutions, which has to be part of this, is there more onus on the local government, or does this have to be more of a federal top-down kind of situation? Because it does seem like, and we cover budget a lot here, every dollar is already accounted for before you really set foot in the room to have that first budget hearing. And we know that you need funding to solve problems. So is this the kind of thing where we should be looking a lot at the federal government for intervention, or can we do a lot to solve this problem here on our own?
I do believe there are so many inefficiencies in our local government that we could do better with the budget at hand, right? I think a lot of people have heard the term social impact bonds. How do we make investments in programs now using the money that exists that we could perhaps leverage some private dollars or other funding to bring in and say, hey, if we're going to do this program that serves 16-year-olds that have a first time gun charge, and we are going to develop an evidence-based program that, let's say, Cincinnati or another city has used. If we do this program that we know has seen large impacts somewhere else, we can bring a return on our investment. So if we spend $1,000 today on that youth in this program, we are going to have a return on our investment that might help us bring some private dollars in using these innovative social impact bonds and other finance mechanisms. And where I'm going with this is really in talking about the inefficiencies. For years, for decades, the criminal justice agencies in the city don't routinely evaluate their strategies, right? We saw this in the 100 shooter report, that there was, a lot of recommendations from the various agencies about evaluating and understanding what works. That's a no-brainer. Why are we talking about that? We knew this 20 years ago. We should only be funding what works. We know what works. Yes, it is a bit more complicated than that, but Philadelphia, with regard to criminal justice intervention and even regard to prevention programming, if we're talking about school-based program, what high quality after care programs, summer jobs, right? Are we doing summer jobs? Are we doing summer jobs with a social, emotional component that really worked well in Chicago? Why aren't we doing that? Why aren't we doing that here? How do we identify these inefficiencies? We need to be evaluating that. We need to be putting this micro lens on everything we're doing. Are we doing what is proven to be successful somewhere else? If not, let's do that. Let's throw out the ones that didn't work, use that funding for things that didn't work, or we didn't even ask our providers in the city to be accountable, right? I think we know from the media's coverage of the last couple of years that there were years and years. We had your colleagues from the Inquirer that were trying to tally all the monies that's been spent to community-based programs and others on gun violence reduction and violence reduction, and there was no accounting of those dollars. Why are we just talking about in 2022? It's time to start evaluating that. And I'll just leave it at that. I'm a researcher, I'm an evaluator. I believe we know what works. We know the programs, the intervention strategies that work, and we also know how to implement them in a way that works. We need city leaders and departments who want to be collaborative, not just with each other, but in researchers around. Philadelphia has so many wonderful universities. It's like a place, we're talking Penn, Rutgers, Camden, fantastic faculty, Drexel, LaSalle. I could name a dozen colleagues right now who spend a good chunk of their time evaluating community-based programs and evaluating collaboratives, but they are fighting to be heard in city government. They are fighting to get dollars. We are fighting to get approval, to get data. I have a colleague who's trying to evaluate medication-assisted treatment for individuals coming out of jails and prisons. And he has now been working with the city legal department for 9 months to get a data license agreement so we could go in and interview individuals in the jail. It is a no-brainer. Medication-assisted treatment has proven to be extremely successful in so many other places. So even if we get the chance to evaluate it, we have state dollars to evaluate this incredible program that links individual getting that are involved with opioid drugs, that are in jail and prison, who are getting these medications in prison, who are then released to the community. This research study is trying to track to see what are the best practices about linking someone who's received this medication in the jails and prison to the community. We can't even do this study to evaluate it because the city, because we can't get a data agreement on this. So again, I'm getting off topic, but this is an issue. Being able to do the research and collaborate in this research is, I think, could move us forward.
But you just touched on something I think is very, very important, and something that maybe is unspoken at times. You're an expert. You work. Your colleagues are experts. the way you're describing the lack of access, especially when we talk about a city, every part of government talks about we're a great city of eds and meds, education. Well, let's use our experts to solve some problems. I'm it's very disheartening to hear that you and your colleagues are having difficulty getting access to places where you could make a big difference. That's very difficult to hear.
It is, and I don't, it is just, I don't, it's no particular agency or no particular individual. I'm not trying to criticize the city government. We just have a bureaucracy that makes it difficult to get things done, right? I don't think the person that's sitting in the legal department in Philly is saying, we don't want to do this, I'm going to stall this, right? It's creating the urgency. Why isn't it a priority to move research and evaluation forward that will help us get some of these answers to the questions people are asking? And I'm not here to complain. I've been doing research for 30 years, but this city is particularly difficult in a variety of functions of getting access to data, not just what you saw, with the 100 shooter report. They're working together, these city departments, to get that. But, will these data be made available to researchers? Could you bring in researchers? There's dozens of researchers who, for no cost at all, would love to have access to these data to run some more analyses, to run additional sophisticated analyses that may shed more light on some of the questions we have, may get to the heart of the causal factors, right? There are cities that open up their integrated data. Camden, I mentioned Camden's integrated data that the Camden Healthcare Coalition manages. They have an entire group that has voiced how much they want their data to be available to the public after you do your human subjects plan and everything that researchers do. We got Allegheny County in Pennsylvania. I've referred a lot of my colleagues in Philadelphia government to individuals working in Allegheny County. Their integrated data system, I'm talking healthcare, behavioral health, schools, criminal justice records, jail records. Did you know that in Philadelphia, our jail database, our city jail database, does not link with our state database? So if Caterina Roman were in and out of prisons and jails for 30 years, you could not go to anyone in the city and say, give me Caterina's jail dates and state dates. Was she incarcerated in jail for 6 months before she went to state prison? You can't do that. It would take you a year as an external researcher to get access to those records and then to actually be able to use them and understand them. And, I do have to say, I love that you're interested in these questions, but I also have to worry in me talking about them, is this going to, again, I should just say, I don't want to complain. There are things that are beyond the fault of any one individual, beyond the fault of any one agency. But how do we come together and say, what are the problems here that would enable data to be available to city agencies and that can be shared, and understanding of these across these city agencies that access to data is really important. We're not here sitting in our ivory tower to get some publication in some great journal. There are dozens, hundreds of academics and other researchers that want to do policy relevant research that will have implications.
I think we cut out for once. Oh, okay. I think we're back.
There.
Okay. All right. Well, I'd like to bring in Denise Clay Murray here on WPPM 106.5 in Philadelphia.
Yes, and thank you again, Dr. Roman, for taking the time with us. And one of the questions that I guess I'd like to end this by asking a question that is often asked of me. When you talk to, like, for folks like us we'll sit and we'll read this report and we'll take apart the data and we'll take a hard look at it and we'll be like, okay, what can be done, what programs can be implemented, those kinds of things. But for a lot of people who are turning on their television sets every night and they're seeing all of this gun violence and they're seeing, people dying, people getting carjacked and all of these different things, how do we, how do we present this, or how do we talk about this in such a way in which the patients that you're going to need to get these programs and things off the ground to make it so this isn't as big of an issue anymore? How do we get people to understand that some patience is necessary, and for the long-term benefit, there's going to have to be a little bit of some short-term growing pains?
I think in the short term, if the city agencies are transparent, if they're saying every month, every 2 weeks on their, they do these briefings, if they're saying we're going to dissect this 100 shooter report every 2 weeks, we're going to talk about these recommendations. Let's put 5 recommendations up that are in this report and dissect them across Commissioner Outlaw, DA Krasner, the mayor, or Erica Atwood, who runs the Office of Strategic Policy in the criminal justice arena, getting them together to say, hey, public, we hear you. We know, as they've been saying, that gun violence is through the roof. We're taking this report and we are trying to make progress, and this is how we're doing it. This is how many carjackings have been. Constantly saying with the data, okay, we just had 15 carjackings over the last 2 months. Here's everyone who's been arrested. Here's what we know. Here's what we don't know. Well, we don't know this, but here's what we're doing to make progress there. Really being transparent. I do think PPD, I do think the agencies are just starting the last 6 months, 8 months to do this. But again, bring the numbers together in a collaborative way to show we're being responsive to the 100 shooter report and what we discussed, and we're going to do as much as we can to make progress tomorrow. And here's our long-term strategy. By using that kind of language, here's our short-term strategy, here's our long-term strategy, and constantly coming back to the progress from the 100 shooter report, where it fell short and how they're moving forward, I think will help the public be patient. But it is hard if you're living in one of those 57 street blocks that has had hundreds of shootings. How can you be patient? So I think victim services, the last thing I would say to answer your question, making sure that we have trauma-informed care, that we have services to be responsive to the victims of gun violence, to those that are witnessing that gun violence, that we know we are taking care of those blocks that are seeing the brunt of it.
Okay, thank you so much for giving us your time, Dr. Roman, and we really appreciate it. And we'd like to have you back on as the 100 shooter report and other things that the city is using in terms of data and how to solve the problem of gun violence come around.
Well, thank you so much to both of you. Again, I think the 100 shooter report is great, and I want to be optimistic. I know we all do, and I am very optimistic. So hopefully when we talk again, we'll be facing shootings that have decreased 50% or more.
Hopefully. Well, thank you so much, Dr. Roman.
Thank you. Bye-bye.